Penile injection therapy is simple to learn. The medication comes in a refrigerated vial, and sterile single-use syringes are also provided, as well as sterile alcohol prep pads. The first step is to draw up the medication. Your physician will have told you what dose that you require, or you may have arrived at that dose over a period of time having used this before. Whatever the dose you need, it's now time to draw up that amount. Uncap the syringe, and remember, only use a syringe a single time. Draw back on the syringe a small quantity of air that will be replaced into the vial for the liquid that is removed. Otherwise, a vacuum effect occurs. Plunge the air into the vial. In this case, we're going to inject 0.20 of a cc, or the 20 mark on this syringe. You'll draw the medication beyond the amount you plan on injecting, and then re-inject it into the vial back to the level you want. This flushes out any air bubbles. Remove the syringe and needle, and make sure that the needle and syringe are set down flat on a clean surface so that the needle is not touching and remains sterile. Allow the syringe to come to room temperature before injecting. In this case, we had a new sterile vial. After the vial has been used for the first time, it's always important to wipe off the vial with an alcohol pad so that each subsequent injection will remain sterile. Now that the liquid has been allowed to come to room temperature, it's time to select a site for injection on the penis. The site for the injection on the penis should be on the side of the shaft, more towards the base than the end. Never inject on the undersurface of the penis. This is where the urethra is, and it will be ineffective to inject in here, and in addition it may cause bleeding in the urine. Never inject in the top of the penis. This is where deeper arteries and nerves run, and there's a greater risk of bleeding. Only inject on the sides, one side or the other. And it's a good idea to alternate sides and alternate distances of injection so as to minimize the risk of scar tissue formation. Once the area has been selected, you'll hold the penis on a stretch and with the dominant hand wipe off the side of the penis. You'll then pick up your syringe and select a site that is devoid of any obvious surface veins. The goal is to inject directly perpendicularly well into the shaft of the penis. Touch the needle to the skin, and then with a forward deliberate movement, thrust the needle all the way to the hub, keeping it perpendicular. Once it is into the hub, then discharge the medication by depressing the plunger. If you meet resistance while depressing the plunger, slightly readjust the trajectory of the needle, but it should be trajectory into the main part of the shaft of the penis. Once the medicine has been discharged, remove the needle and hold pressure on this site with the alcohol pad for 2 minutes. After 2 minutes, you can release pressure, and you can expect an erection to occur sometime in the next 5 to 20 minutes. If an adequate erection does not occur, there are a couple of possibilities. One, you need to use a larger dose of medication the next time. Do not do it at this time, as you run the risk of overdosing and causing priapism. Wait another day or two. Another possibility is that you accidentally injected it too low into the urethra, or you missed getting into the body of the penis. Always ensure that you're going right in the center of the shaft all the way to the hub before discharging the medication. If when discharging the medication you meet some resistance, gradually reposition. You may be up against the wall of the penis. As long as it's flowing in easily and smoothly, you should be in the right space. If an erection occurs that lasts more than 2 to 3 hours, seek medical attention.